Good morning and thank you for joining us. I'd like to start off with a brief case announcement. We have 2 new cases to announce this morning for a total of 50 cases here in Lane County, roughly 2,516 tests coming from Lane County to our area labs. The first case that we're announcing today is really actually a success story. This is a woman in her 40s who lives in rural Lane County, and she is medically stable and recovering at home. There is an Epi link that we identified with this case, and the reason that we even identified the case to begin with was because that Epi link was identified through a contact tracing. So this person works at an office, a small office, where we identified an initial case, and then we're able to identify another case. In that circumstance where we're seeing multiple cases, the recommendation really is to test everyone. And so this person was identified through that testing process. So really a success story in terms of contact tracing. Our next case is a woman in her 70s from the Eugene-Springfield area. She is at home and recovering. I'd like to also talk a little bit today about what we're going to be shifting to in terms of providing you with information. You'll recall that Dr. Ludke a couple of weeks ago listed out 7 criteria for which he is considering on his recommendation to the governor and to the state on reopening things in Lane County. What we want to do is provide measurable metrics on each of those 7 points. And we're going to be doing that and creating a dashboard for you, putting that on our website, as well as providing updates via these press conferences, so that you can be aware, have a little bit of an expectation about when we could potentially make that recommendation and where we're at in that process, so that folks don't feel left in the dark or wondering where we're at. And as you recall, some of those things are adequate PPE. We want to be able to define what adequate means for you, sufficient testing, what does sufficient mean, and where are we at in that process. So we're going to be making that available here shortly, and we're currently just working out those metrics, and hopefully I'll have something to announce to you very soon in terms of being able to visually show you that. Next, I'd like to show you a little illustration here. Over here, you'll find our Epi Curve. The Epi Curve is in the blue, and you'll see that what we have going on right here is a slow flattening. And we believe that we're right around in here on that plateau sort of feature. What we have right here in the dotted line on the black is what could have happened. Starting in about early April, this is early March. If we had business as usual and or we weren't successful at being able to contain the virus, we would have seen a peak. Probably sometime, right as this was escalating. You can see that exponential. That's what could have happened. And then it would have peaked. We have not peaked. There is no peak happening. Thankfully, what we're seeing is a flattening. And that's indicated by these sort of slow trickling in of 1 or 2 cases a day. And down here is our active cases. So these are the actual number of people that have it, and we're seeing that drop off. So, these are all absolutely fantastic visuals. This is exactly what we want to be seeing. However, I think it's really important as we start to talk about this, we're talking about it so we can be transparent, so we can help you track with where we're at and what we're actually seeing, namely that plateau. But it's really important that we don't start to get the message out there that we're out of the woods or that things are okay. That is absolutely not the case. That even though we're plateauing and we're very happy with that plateau, that since we have active cases in the community and we still are seeing new cases pop up, that any point in time, this right here can turn into another peak. And that rapid acceleration is something that is a very real possibility if we go back to business as normal. And that's not meant to be a scare tactic. We don't believe that's going to happen because we've seen such great cooperation in our community, and we see people really trying to physical distance, and we see people wearing their mask when they can't maintain that social distancing. So that right there, just wanted to provide that visual for you. We have this up on our website. You can see this. But just wanted to make that available today for people. We also got some comments, speaking of masks, asking, why don't you wear a mask when you're doing the press briefings? So the main reason why we don't wear a mask at the press briefings is because we have quite a few folks in Lane County who are hard of hearing. And obviously we have an ASL interpreter to be able to provide sign language, but another part of being able to track with what we're saying is being able to read lips and be able to see facial expressions. And so that's really limited with wearing a mask. So we try to clean as best we can, maintain social distancing within the room. If I was able to switch the camera back, you would see that our camera operators and the people from Metro TV are wearing masks. So that is something that we absolutely do observe within the room. I just don't wear one while I'm talking to be able to communicate effectively. I do have one. This is my Buzz Lightyear mask that my mother actually sent up to me. And I do wear that anytime that I'm not, I can't social distance. So anyhow, last but not least, I'd like to point out the fact that May 19 elections this year, 2020 in Oregon, are happening. And there are some details that we'd like to share with you right now. If you recall, Oregon was one of the first states, or the first state, to conduct elections entirely by mail, which positions us very nicely to be able to continue on with our elections process safely and not put people at risk by having them go to a ballot box. So it's good news that our elections will happen, but we'd like to provide you just with a few details. I'm going to go ahead and read these off because this is very important information. I don't want to get anything wrong. So the registration deadline, so if you haven't registered or you need to update your registration or your party affiliation, that deadline is Tuesday, April 28th at 11:59 if you choose to do that online. And that website to be able to do that online is OregonVotes.gov. So just make sure that you're aware that there is a deadline to make any changes or to register, and that deadline is April 28th at 11:59 p.m. In order to do that, though, you will need an Oregon driver's license, an Oregon learner's permit, or an Oregon-issued ID card. So please keep that in mind that you're going to need that piece of identification in order to register. If you choose to do registration by paper form, and so these are those forms that you can actually physically register. These are at the post office. They're at our public service building down on 8th Avenue here for the county. They're around the community. But if you choose to use that paper form, please be aware that the deadline date remains the same, that it's April 28th, but the actual time is a little bit earlier. You need to drop those off by 5 p.m. into the drop-off box on Lincoln Street at Lane County Elections. So please be aware that it's a little bit earlier, 5 p.m. Again, if you choose to do that on the website at OregonVotes.gov, you have until 11:59 at night. With that said, our drop box is open. Folks can drop off their ballots or their voter registration. They're at the Lane County Elections Office on Lincoln, but we are not taking walk-ins. So that is just to try to protect the safety of both our community and our staff. However, if you have questions, you can reach out to Lane County Elections via a phone number. That phone number is 541-682-4234. Again, that's 541-682-4234. Finally, I'd like to make sure that folks are aware that there was a Facebook link that was put out there about voter registration. You may have seen that, and if you clicked on it, you'd find out that it doesn't actually go anywhere. The Secretary of State's office in Oregon has been notified about that problem, and they're working with Facebook to resolve it. But you can always go to OregonVotes.gov and do that anytime without having to go through the Facebook link. Also, just so you know, and you're aware, if you haven't voted before, or if you have a lot on your mind, which most of us do right now, and you get your ballot and you don't see some of those partisan parties, if you're an unaffiliated voter, you won't see the partisan candidates. Those will only be listed if you've registered with a party affiliation. So just be aware of that. And that's all we have. I'll take any questions from members of the media now.
Emma with KEZI would like to know whether the governor's announcement about returning to non-emergency medical procedures changes the timeline for reopening.
So Emma from KZI would like to know whether or not the governor's announcement about returning to elective procedures at medical facilities will change the timeline. You know, this is a decision that came from the state level. We are aware of it. I don't have information on whether or not that changes the timeline, to be honest. I do think that we are well positioned to be able to navigate that change. However, I can't provide that level of detail, and I'd encourage you to reach out to the state on that one. And that's all we have today. Thank you for joining us.